Hello and welcome to the Anxiety Disorders Association of British Columbia website and to this special section on childhood anxiety. I'm Dr. Michael Catchpole. My guest is Dr. Jane Garland. Dr. Garland is a professor of psychiatry at the University of British Columbia and clinical director of the Mood and Anxiety Disorder Clinic at the University of British Columbia. Dr. Garland, thanks so much for being here.
Thank you for having me, Dr. Catchpole.
Dr. Garland, we're going to talk about obsessive-compulsive disorder in children. Could you give us a definition of what obsessive-compulsive disorder is?
The key things in obsessive-compulsive disorder are obsessions and compulsions that are going on to such a degree that they interfere with the child's functioning.
Let's pull those two apart then. Could you talk about obsessions first of all?
An obsession is an unwanted thought, and most obsessions are pretty unpleasant. They might be what children would call gross thoughts, or violent thoughts, or scary thoughts, things they don't want to think about, that keep repeating themselves over and over again.
Wow. And how about compulsions?
Compulsions are repetitive behaviors, rituals and habits, and it might be something, for example, like washing your hands over and over again for many hours a day.
Now, I'm assuming these two can knit together or sort of feed off each other a bit. Is that correct?
Yes, there's a connection. Many times, for example, a child will have an obsessive thought that they might get a disease, and that leads to the behavior of excessive hand washing. Washing their hands makes them feel less anxious about the thought.
Okay, let's talk about some home management strategies. For example, on that one you just gave about children washing their hands a lot to prevent disease, what could a parent or caregiver do in that situation?
First step is information. We know that if you wash your hands too much, in fact, you wash off the good germs and you're more likely to get infections and cracked hands. So parents can tell their children that.
Okay. Now let's zero in first of all on compulsions. Could you talk about home management strategies for compulsive behaviors in kids?
Well, keeping with the example of excessive hand washing, if they're washing their hands for 5 minutes each time, what we might do is negotiate for them to wash them for 3 minutes and give them a reward for practicing not washing them longer. So we might use a timer and have some kind of a point system or reward system for practicing not doing. That process is called exposure and response prevention. In other words, they're in the situation of washing their hands and we're helping them stop themselves from doing it excessively.
All right. How about obsessions, these thoughts that children have that are unacceptable? What can a parent or caregiver do in that situation?
Obsessions can be tricky because children will ask their parents for a lot of reassurance, and that can become a compulsive habit. So what we do is we remind children and have parents remind them that many of these thoughts are common, like a hiccup of the mind. We all have unwanted thoughts. The key is to not pay too much attention to them.
And yet also, I guess, not to try to block them either.
Exactly. So we might reassure the child once, because they're asking for reassurance excessively, and then maybe refocus their mind on something else. Get them involved in something more interesting.
And for example, you know, if they're having a gross thought, for instance, I mean, what's a parent to do in that situation? What would be the most helpful thing to do?
Well, one of the things to recognize is the children and the parents are often worried that that means something about the character of the child. What kind of a person would have such an awful thought? And they need to recognize that those thoughts are common, passing through. The problem is the child has begun to over-focus about it or worry about the thought itself.
So if you tell me not to think about pink elephants, for example,
You're going to think about them, exactly.
Okay. Other strategies, home management strategies for parents and caregivers?
The global approach is to make sure that these kids begin to function and that the obsessions and the compulsions don't get in the way of that. So what we do is focus on reducing the amount of time doing those behaviors, practicing not doing them, and then look at trying to return them to normal function. What's interesting about kids with obsessive-compulsive disorder is they often do well with more structure. For example, they have fewer symptoms at school than they do at home.
Dr. Garland, thank you very much for this really informative interview on obsessive-compulsive disorder. My guest has been Dr. Jane Garland, professor of psychiatry at the University of British Columbia and director of the Mood and Anxiety Disorder Clinic at the BC Children's Hospital.